My name is Dr. Toby. I'm the naturopathic doctor and acupuncturist here at the Pilgrim's Wellness Center. A lot of people didn't realize that we have a wellness center or a clinic here at the market. So we've had it here for about 2 years. But since a lot of people didn't realize it and know what was going on here, they wanted to bring in a naturopathic doctor to kind of run it and start really turning it into an integrative center. So I came in about 5 months ago from an hour south of Buffalo, New York. I'm also an acupuncturist, and I had a busy practice there in New York, and had a 2.5-year-old son 2.5 years ago, and things just got really hectic and crazy. I was working out of a beautiful registered historic home, and needed to make a change, stop working out of the house, and come to a place like this. So I'm looking forward to becoming part of this community here, and I really appreciate you guys coming out. A couple of things before we get started. Restrooms are in the back, and there's a sign-up sheet here if you don't already get the emails from us, if you'd like to get emails of all the different happenings that are going on in the Wellness Center and also with the market. And some information is there about me. And there's also pads of paper and pens if you'd like to take notes or things that you want to jot down. I'm a naturopathic doctor, as I said. In 15 states, naturopathic medicine is licensed. We're licensed as primary care providers. That means we do physical exams, lab work, imaging, prescribe pharmaceuticals, but our focus is on natural therapies. Idaho does not currently license naturopathic doctors. I am licensed in Washington State. The therapies that we focus on naturally are botanical medicine, homeopathy, hydrotherapy, nutrition, diet, those types of things. And I am, as I said, a licensed acupuncturist here. So before I get into the content of today's talk, I just wanted to say that normally when I come and do talks, I don't talk professionally. There's usually not just one circuit that I go around talking about. So usually I put together the whole slideshow, and usually I pack way too much information there and all the details, but I like to tell a story. But I always get from people that they just wish I would just connect and talk with them firsthand like that. So I'm going to try that tonight with you. And I'd like this to be kind of like a discussion, a little bit interactive. I do have a story that I want to tell, and there are some details that need to be talked about, but I also want to be there to answer your questions. So we'll kind of go through this together, and but please feel free to raise your hand, interject, and add your thoughts and your experiences if you'd like. Okay? So the topic today is cardiovascular disease and things that we can do naturally to help with it. And that's both preventive and also therapeutic. Let's just talk a little bit about what cardiovascular disease is and what we think about. So, when we say the word cardiovascular disease, what comes to mind? What are the things that we're trying to prevent? What are the two major things that we think about?
Stroke and heart attack.
Yeah, heart attack and stroke. Okay. So what causes this? Where do we get heart attacks and strokes from? Clogged arteries. What else? What causes that? Well, how do we get clogged arteries?
Clot goes to your brain or your heart.
Okay, and what causes that clot?
Eating fat.
Eating fat? Okay.
High blood pressure.
Okay.
High cholesterol.
High cholesterol? Okay. Right, so these are all the things that have been ingrained in us to think about, right, with cardiovascular disease. You eat fat, you eat high cholesterol, you can have heart attacks and stroke. All right, so how do we test? What's a good screening test to find out if you are high risk for having a stroke or a heart attack? What do we test for?
C-reactive protein.
C-reactive protein. Okay, that is true. Yes. Yep. But what's a big one that we think about? We even advertise it in the newspaper. Cholesterol. Okay. So cholesterol, we do check blood pressure, but primarily we're thinking of looking at cholesterol, right? So what is it? What exactly are we testing for with cholesterol? Let's write it down here. We're testing for
LDL.
Okay, LDL.
Triglycerides.
We're also testing, when we say cholesterol, usually we're talking about like total cholesterol, right? So we'll call that total cholesterol here.
You want to test the percentage with the two?
Yeah, the ratio, like, right?
Triglycerides.
Right, triglycerides, total cholesterol, LDL ratio.
HDL.
Right, HDL. Well, okay, let's even go back a step. So what's LDL? How do we like to refer to LDL as? The bad cholesterol, okay. And HDL we refer to as the good cholesterol. Okay. Am I missing anything? We always like to check glucose. I think that is important, right? So that's what we do on our screening here. We actually offer, for the month of February, if you haven't had your cholesterol checked and you want to, we do offer screening here for $10. It's just a drop of blood. We do it while you're sitting here for like 10 minutes. Actually, Shelly, if you come to the store and ever go to the nutritional section or the supplement section, she's often here to help out, but she's out of town, so I've been helping out the last couple weeks. But it just takes 10, 15 minutes. You call, sign up, we can test it for you if you'd like.
So you have to fast or anything?
You do need a fast, yeah. We need to schedule you. You call and then we schedule you, but it's $10 and we can test these things. Okay, so what are the levels that we want them to be below? What do we think of for cholesterol?
200.
How much?
Below 200, the full throw.
For total cholesterol? Okay. No. Before I write it down there, let's just, yeah, total cholesterol, right, 200. All right. What do we think about for LDL? Since I'm being filmed here, I'm going to make sure I write it down. What do we think of for LDL?
70.
For LDL, it's 100. This is usually what we want to get it underneath. For triglycerides, 150. And the ratio, you want it to be less. Anybody know the ratio?
Less than 5.
Yeah, 4.5. You can't see? Is that what I heard? Or I can't write. Okay, HDL.
Over 40.
Yeah, greater than 40. Or I don't know why I can't. I guess I can't write upside down. Greater than 40, and then or ideally we want it greater than 60, right? We're going with the standards here. And then glucose we want less than 99. Okay. So in the current conventional medicine, so I like to refer to Western medicine, allopathic medicine, as conventional medicine because that's the convention. You go to your medical doctor, and what do they like to do if your levels are out of balance, if you have too much cholesterol? Okay, like for example, statins are the big ones, right? Okay. And the goal of the medication is to lower your cholesterol, okay, and your triglycerides, right? And what'd you say?
Kill your liver.
And to increase the HDL, right? That's what we're shooting for. So, what I think I already asked this, but what causes high cholesterol?
Fats, sugars. Family is stress.
It could be hereditary.
Yeah. And what's the big thing? I mean, especially since the 80s.
Sugar.
Fat, right? Okay. Yeah, there's other things there that we've touched on, but right, it's fat is the big thing, right? Okay. So, conventional medicine, here's an article done in the UK in 2007, or that's when it was printed, but it's just reviewing how effective statins are and if it's cost, because the UK is, I don't like to use the term social medicine, but it's, what do you call it, a single payer system, right? So they want to make sure that if they're spending the money that you're getting the benefits out of it, right? So, do statins work? Well, it could be debatable, but here's a study, it's a meta-analysis done in 2007, and they say, let's see, meta-analysis of the available data from the placebo-controlled studies indicates that in patients with or at risk of cardiovascular disease, statin therapy is associated with a reduced relative risk of all-cause mortality, cardiovascular mortality, coronary heart disease mortality, fatal myocardial infarction, but it doesn't help with fatal stroke. It is also associated with a reduced relative risk of morbidity. Mortality means you die, morbidity means you get sick. So a reduced risk of morbidity, non-fatal stroke, non-fatal MI, TIAs, unstable angina, and of coronary revascularization. Anyways, statins are generally considered to be well tolerated and have a good safety profile. This review is generally supported both by the evidence of the trials included in this review, blah, blah, blah. There is evidence to suggest that statin therapy is associated statistically significant reduction in the risk of primary and secondary cardiovascular events. The cost-effectiveness ratios are dependent on the level of CHD risk and age, but basically they're given thumbs up for it, okay? Conventional medicine, yeah, look, the studies are here. If we get the numbers down, it helps, right? There are a lot of studies that do show that, okay? What are, and I'm sure some of the reason why you're here is because you're familiar with this. What are some of the potential problems with statins? What are some of the side effects? Okay.
Weakness.
Muscle weakness.
Memory loss.
Memory loss. Fatigue. Aching muscles. Decreased immune system. Anybody know what causes this? Or some people probably heard about this, right? How do the statins work? I'm sorry, what's that?
Take the fat right out of your brain, that type of thing.
Well, they work on the liver, and they prevent. Part of the ways that it does it is it prevents the production of cholesterol, and in so doing, those statins also prevent the production of CoQ10. So there are studies out there, and clinically we see this. I've seen it a lot with patients. So those people who a lot of people who end up having the symptoms or side effects of the statins, they end up developing a CoQ10 deficiency. And if you supplement the CoQ10 deficiency, a lot of times the statins, you won't have the side effects. The other thing, if anybody, what else is CoQ10 good for? For your heart. Okay, raise your hand if you've heard of CoQ10 before. Okay, and yeah, we know CoQ10 is an important antioxidant, an important nutrient that provides the energy for your heart so that your heart functions. It is also important for your brain and other areas of your body as well. But we are depleting CoQ10 when you take the statins, and that is going to make things more difficult for your heart. So what are some of the foods that we've been told to stay away from?
Meats.
Meats? Yeah, red meat. What about what other, the fats we already talked about? The fats, cholesterol, butter, eggs, cheese. So I thought it'd be really, really appropriate to have those things as a snack here. And I do mean it is really appropriate. So, okay, have you ever heard of Dr. Mercola? Probably a lot of you guys have heard of him. I do like him a lot, and I'm going to be reading. I like the way he presents his argument. So he doesn't argue. Okay, let's state this. What I presented to you is the conventional way of thinking about heart disease. Okay, and we already mentioned one thing. If you're taking statins, one of the things that you can do naturally to make them more effective and to minimize the problems or the side effects is to take CoQ10. Another thing that seems to be important if you're having problems, side effects of taking statins, the other thing you could do is take vitamin D. There are studies that show vitamin D is important. And the reason for that is Anybody know what the, what do you call it, the substrate, or how do we make vitamin D in our bodies besides the sun? Okay, and the sun, we won't go through the whole process, but the sun turns cholesterol into vitamin D. So the cholesterol is a substrate for it. So it kind of makes sense that that seems to be helpful, or that would be involved in the process. But there are studies that show by giving, if you're low in vitamin D, if you take vitamin D, that can help with the side effects. Okay, so back to Dr. McCullough. He does a really good argument to look at, that was my presentation on the conventional. Now we're going to go a little bit into alternative, okay? And I can answer conventional as well for you. Where do I sit as a naturopathic doctor involved in the sciences of Western medicine? Of course, I understand that this is the convention, but I want to share things with you that I would like for you to think about. They're not mainstream. They're not mainstream, but I want to share that with you because I think it's important. And these are things that you can discuss with your healthcare provider and can do the research on your own. So one of the most important things that I think about when we talk about alternative medicine and integrative medicine and why it's become so popular in the last 10, 20 years is because it's about empowering you to make the right decision. So you wouldn't be here tonight if that wasn't the way that you thought, okay? So with that being said, we'll move forward. So Dr. Mercola and Dr. Rosedale, you may have heard of the Rosedale diet. They kind of spelled out this argument together, or I like the way that they phrased it. So cholesterol could easily be described as a smoking gun of the last 2 decades. It's been responsible for demonizing entire categories of foods like eggs, saturated fats, and blamed for just about every case of heart disease in the last 20 years. You're probably aware that there are many myths that portray fat and cholesterol as one of the worst foods you can consume. Please understand that these myths are actually harming your health. Not only is cholesterol most likely not going to destroy your health, as you have been led to believe, but it is also not the cause of heart disease. What is cholesterol and why do you need it? That's right, you do need cholesterol. This soft, waxy substance is found not only in your bloodstream, but also in every cell in your body, where it helps to produce cell membranes, hormones, vitamin D, and bile acids that help you to digest fat. Cholesterol also helps in the formation of your memories and is vital for neurological function. Your liver makes about 75% of your body's cholesterol. So there are 2 types. We talked about it. There's HDL, high density, and LDL, low density. The high density is the good cholesterol that helps to keep cholesterol away from your arteries and remove any excess from arterial plaque, which may help to prevent heart disease. LDL, this bad cholesterol, circulates in your blood and, according to conventional thinking, may build up in your arteries, forming plaque that makes your arteries narrow and less flexible. A condition called, what do we call that Western medically? Atherosclerosis. If a clot forms in one of these narrowed arteries leading to your heart or brain, a heart attack or stroke may result. Triglycerides, what are they? They have been linked to heart disease and diabetes. Triglyceride levels are known to rise from eating too many grains and sugars. Being physically inactive, smoking, drinking alcohol, and being overweight or obese will cause a rise in triglycerides. Lipoprotein A is a substance that is made up of an LDL bad cholesterol, but it's also got a protein involved, apoprotein A. Elevated LPA levels are a very strong risk factor for heart disease. This has been a very well established, yet very few physicians check for it in patients. The American Heart Association recommends total cholesterol at 200, but what they do not tell you is that total cholesterol level is just about worthless in determining your risk for heart disease unless it is above 330. So keep that number in mind, 330 for total cholesterol. What did we say for total cholesterol? 200. There are, in 2004, the American Heart Association recommended that we have levels less than 130. and even less than 100. Even less than 70 for patients who are at very high risk.
When was that?
2004.
Wow.
That's American Heart Association, and I forget where I have that written down, but I think it was like 8 of the 9 people who came to that decision were on the boards for the statin, companies. So, and it wasn't even just that they're on the boards; they actually were literally shown to have made money off of the medications. So, HDL percentage is a very potent heart disease risk factor. That's okay, we won't go there. Okay. So cholesterol is neither good nor bad. This is from Dr. Rosedale, and you can find his book. It's called The Rosedale Diet. Notice, please, that LDL and HDL are lipoproteins and fats combined with proteins. There's only one cholesterol. There is no such thing as good or bad cholesterol. Cholesterol is just cholesterol. It combines with other fats and proteins to be carried through the bloodstream, since fat and our watery blood do not mix very well. Fatty substances, therefore, must be shuttled to and from our tissues and cells using proteins. LDL and HDL are forms of proteins and are far from being just cholesterol. Also, some HDL particles are better than others. Knowing just your total cholesterol tells you very little. Even knowing your LDL and HDL levels will not tell you very much. Cholesterol is your friend and not your enemy. In the United States, the idea that cholesterol is evil is very much ingrained in most people's minds, but this is a very harmful myth that needs to be put to rest. First and foremost, Dr. Rosedale points out, cholesterol is a vital component of every cell membrane on Earth. In other words, there is no life on Earth that can live without cholesterol. That will automatically tell you that in and of itself, it cannot be evil. In fact, it is one of our best friends. We would not be here without it. No wonder lowering cholesterol too much increases one's risk of dying. Cholesterol is also a precursor to all of our steroid hormones. Like we talked about, it was a precursor to vitamin D. You cannot make estrogen, testosterone, cortisone, and a host of other vital hormones without your cholesterol. If your cholesterol level is too low, you will not be able to use the sun to generate sufficient levels of vitamin D. HDL. Essentially, HDL takes cholesterol from your body's tissues and arteries and brings it back to your liver, where most of your cholesterol is produced. If the purpose of this was to eliminate cholesterol from your body, it would make sense that the cholesterol would be shuttled back to your kidneys or to your intestines so your body can eliminate it and remove it. This doesn't happen. It brings it back to the liver so that you can recycle it. It is taking it back to your liver so that your liver can recycle it, put it back into the particles to be taken to tissues and cells that need it. Your body is trying to make and conserve the cholesterol for the precise reason that it is so important, indeed vital for health. What's the connection between cholesterol and inflammation? You had mentioned that we're testing for CRP, which is a measure of inflammation. So, what's the relationship between inflammation and your heart and blood vessels? Your blood vessels constrict to keep you from bleeding. Or what is the function of inflammation, right? Like you can even think if we get a cut or we injure ourselves, it's a natural response to that injury to bring our body's healing energy there so that a bunch of these things do and do not happen, right? Our blood vessels constrict to keep you from bleeding to death. Your blood becomes thicker so that it can clot. We need a clot so we stop bleeding. Your immune system sends cells and chemicals to fight viruses, bacteria, and the other bad guys that could get involved into that area and infect that area. And then cells multiply to repair the damage. Ultimately, the cut is healed and a protective scar may form over the area. If your arteries are damaged, a very similar process occurs inside of your body, except that a scar in your artery is known as a plaque. Okay? If your arteries are damaged, a very similar process occurs inside of your body, except that a scar in your artery is known as a plaque. So if you have damaged cells that need to be replaced, your liver will be notified to make more cholesterol and release it into your bloodstream. This is a deliberate process that takes place in order for your body to produce new healthy cells. So you have an injury, and your body's making more cholesterol to help heal that area. It is also possible that, and quite common, for damage to occur in your body on a regular basis, right? Chronic inflammation. The test usually used to determine if you have chronic inflammation is C-reactive protein. It's a blood test. CRP level is used as a marker of inflammation in your arteries. Generally speaking, if your CRP is under 1 milligram per liter, it means you have a low risk for cardiovascular disease. 1 to 3 milligrams means your risk is intermediate, and more than 3 milligrams is a high risk. In the eyes of conventional medicine, when they see increased cholesterol circulating in your bloodstream, they conclude that it is not the Let's start over. In the eyes of conventional medicine, when they see increased cholesterol circulating in your bloodstream, that increase in cholesterol in your blood is the cause of heart attacks, not the underlying damage to the arteries. Right? They're saying the cholesterol is a problem, not the damage to your arteries. Anybody heard of Weston Price, the Weston Price Foundation? Okay, it's a really neat group. There's a couple specialists there who specialize in fat lipid biology, and they look at the way traditional societies have eaten. We'll get into that in a little bit. But anyways, Sally Fallon, she explains something that I think is really important. If you have increased levels of cholesterol, it is at least in part because of increased inflammation in your body. The cholesterol is there to do a job, to help your body to heal and repair. Conventional medicine misses the boat entirely when they dangerously recommend that lowering cholesterol with drugs is the way to reduce your risk of heart attacks. Because what is actually needed is to address whatever is causing your body's damage, and what is leading to inflammation and leading to your body to making and creating more cholesterol. What happens when your cholesterol is too low? One large study conducted by Dutch researchers found that men with chronically low cholesterol levels showed a consistently higher risk of having depressive symptoms. So you can get depressed if your cholesterol is too low. Canadian researchers found that those in the lowest quartile of total cholesterol concentrations had more than 6 times the risk of committing suicide. So if you were in the lowest quarter, if your cholesterol levels were really low, there was a 6 times increased risk of committing suicide as those who have higher levels of cholesterol. Other things have linked to cancer, to Parkinson's disease. What cholesterol level is too low? According to Dr. Rosedale, Dr. Mercola, and some other experts and specialists, they say anything under 150 would be too low. An optimum level would be 200. So our total cholesterol level 200. So we're not bad if we try to get, maintain a cholesterol level 200. But if we start going down to 100 or 70, that is extremely low, and that our bodies are designed to have much higher levels of cholesterol. And in fact, the way that I like to look at naturopathic medicine, the way that I practice medicine, I like to look at the body. I like to see what's out of balance. And my job is to help the body. I feel that there's an innate ability in the body to heal itself, and that our job is to facilitate that and to give the body what it needs and to remove obstacles to cure. So we like to look for what's out of balance, and by getting your cholesterol levels too low, that is creating something that is out of balance and not normal. An interesting thing, if we look at cholesterol and we look at some of the studies, is the number needed to treat. How many patients or how many people need to take a drug so that you get the expected benefit. So a lot of times it'll be like, 50 people need to take it to prevent 1 heart attack, right? So this is a meta-analysis of Lipitor, and this is even what it states on their the little insert. I think it was on their insert, but this is their marketing. So for every 100 people who took the drug over 3.3 years, 3 people on placebos and 2 people on Lipitor had heart attacks. For every 100 people who took it, 3 people on the placebo had a heart attack and 2 people on the Lipitor had a heart attack. So based on that, that means that taking Lipitor resulted in just 1 fewer heart attack per 100 people. However, because of that ratio, they're allowed to claim that there was a 36% reduction in heart attacks. Well, even if you did and I'm not so good with math anymore. I used to be, not anymore. But I think if that's like 3 and 2, it's like around 33%. So, and if you look over the big picture and some different factors, 36, I think that's that ratio, right? I don't know if so that's what I'm thinking, okay? So in this case, to get 1 fewer heart attack, 100 people need to be on Lipitor. That's their marketing. So what about the other 99 people on Lipitor? How about, here's a study about, or some information about Cedia and Vytorin. The trial by the drugs makers, which studied whether Cedia could reduce the growth of plaques, found that plaques grew nearly twice as fast in patients taking Cedia along with Zocor than in those taking Zocor alone. What do I want to say? Oh, plaques actually grew faster when they were taking Cedia together with Zocor than when they were taking Zocor alone. And what Cedia is it prevents your body from absorbing the cholesterol. So statins are thought to have a beneficial effect on inflammation. Oh, so there is research, like I pointed out, that shows that there is some beneficial effect of taking the statins. But there is research out there that shows that this can be related to its ability to help with inflammation. So in addition to lowering cholesterol, they have an anti-inflammatory effect, these medications do. But you can also lower inflammation naturally. And so those are some of the things that we will talk about. Anyways, what we asked for in the beginning of this lecture, I said, what do we think of, since the 80s particularly, but even it's got started in the 50s, as far as what causes, what's the cause of heart disease? And the answer was, we said fat. So that's sort of the lipid hypothesis. When I work with patients, one of the things I do, if I make any recommendation, I always like to give the literature and the information, the research behind the decisions that I make or the recommendations that I make. So I'd like to, if you would like any copies of this, if you want to write down your name or your name and email address, I'd be happy to forward this information to you. Let me take a drink while I'm losing my voice. And I do have a really good article that goes into the depth of how there was bad research or not truthful research behind this. So there was like 22 studies that they looked at back in the 50s. The guy's name was Key. And he showed, like, epidemiologically, they looked at like 22 different countries and looked at the foods that they were eating and showed, like, the more fats they ate, the more cardiovascular events they had. Well, it turns out he was selective. He only showed 7 to point out that graph, like the more fats the societies ate, the more cardiovascular events they'd have, right? So he handpicked 7 out of the 22 to show that. Now there was an overall trend. There was a little bit of a trend to show that there was the more fats, but it's more complicated than that. And what the whole industry has done since the 50s is keep referring to those studies. And then there's all these other studies. And I don't know if you guys know Thorne. They're up in by Sandpoint, Priest River. They make a lot of nutraceuticals, and they've done a lot of research. And they started quite some time ago a peer-reviewed journal for alternative and naturopathic medicine. There's a great article written about that and looks into that, and I have access to that. I could forward that to you if you'd like. But some of the things, okay, as Americans cut out so because of that, we've been cutting out nutritious animal fat from the diets, and people were hungry. So what you guys know this now. If you're not eating fat, what are we eating? Sugar, right? High fructose corn syrup, boom, right, in the 80s. We all think we're being healthy. Well, you know, we would think this is kind of disastrous, most of us who pay attention to this, right? Because what do we know? Diabetes, Syndrome X, obesity. I mean, it's out of control. We're not getting healthier. Okay. So that's part of my story there. You can lower cholesterol naturally, and well, so I don't forget, why don't we talk about some of the things that you can do. The most important thing is the oxidized cholesterol. So you don't want to eat any fats that are rancid. So even like eggs have good cholesterol in them. You don't want to fry them. Or at least even if you fry them, you want the yolks to be runny. And that means it's not oxidized. So soft boiling them is a really good way to do it. Poaching them, even if you're going to fry it, just try to make them at least runny, okay?
Scramble that and that.
It's not as good for you. It's going to, the heat and the exposure to the air oxidizes it. I'm not entirely sure if by what do you call them? Like over easy or a fried egg, it's not being exposed to the air, but I still think the high temperatures would also, it's definitely better to have a soft runny yolk. So try to eat your eggs that way.
So a hard-boiled egg wouldn't be good?
Yeah, no, I mean, that might be a little bit better, but it's still, yeah, I'm pretty sure it definitely would be better to have it runny. Okay. Eating lots of sugars and grains increase cholesterol. Eating foods cooked at high temperatures. Eating trans fats. So remember, like we were telling everybody, get away from butter, and what were we going to margarine? Well, we know that the margarines are all the trans fats. Now they're coming out with some that are better, that don't have the trans fats in it, but it's still, as we're going to get to, is not as good for you as doing butter, and we'll get to that. Sedentary lifestyle increases cholesterol. Smoking increases cholesterol. Emotional stress increases cholesterol. Animal-based omega-3 fatty acids decrease cholesterol. Decreasing sugars and fructose decrease cholesterol. Eating raw food helps. Eating good fats like olive oil, coconut oil, raw dairy products, avocados, raw nuts, seeds, eggs lightly cooked with yolks intact, and organic grass-fed meats. We're going to talk more about that, but it's important to stop smoking and decrease excessive amounts of alcohol and address emotional challenges. So from the whole idea of balance, these are some of the things that we can do. I don't know if I said exercise, but exercise, of course, is really important. There's studies that show omega-3 fats do more to normalize your cholesterol than Lipitor and other statin drugs, and are safer and less expensive. Okay. So sort of the take-home message is that the cholesterol is not bad, but the inflammation is the problem. And this, I'm just going to describe that a little bit further. Localized inflammatory responses in the intimal layer of the arterial wall have been shown to be responsible for many of the aspects of intimal thickening and plaque disruption. So, you know, having a plaque can be stable, but when it disrupts, and that's when you have the problems. That's when it goes into your heart, and that's when it goes into your, into your brain and causes strokes. CRP is a really good cardiovascular risk assessment tool, along with total cholesterol and the HDL ratios, and then also looking at homocysteine levels can be really helpful. It has been shown that the HMG-CoA, which is the statins, can reduce inhibitors, the reductase inhibitors, they can lower C-reactive protein levels. So they're, like I said, decreasing inflammation. So that's part of how they're doing it. The other things that have been shown naturally to do that, red yeast rice is you probably heard of that, is a good alternative to also bring down your cholesterol levels, and there's a number of studies that show that. But what you may or may not know is that there is naturally occurring Lovastatin in it. And there's other cholesterol-lowering compounds in red yeast rice. And some have antioxidant effects, so that means it helps with inflammation. Red yeast rice. Now we get it as an extract. It's I believe it's a type of rice that they've been able to extract. It was done in China, and there was a really important study there. It was not, for various reasons, it was not, that particular extract was not allowed on market, but we have other extracts. The one that was studied had like 8 to 9 different types of compounds that are called, how do you pronounce them? Monoclins, which is like what the like Lovastatin is. But they have 8 or 9 different ones in them. Now, there are a lot of other formulations out there that from different companies that do that, and we've seen clinically that it does help with it, and there is research to show that it does help. But part of the way that it helps is through its antioxidant effects and other mechanisms besides the statin. I don't know, I have that somewhere, but I think there's like, you know, for like Lovastatin to work, it's like you take 20 to 40 milligrams. In a therapeutic level of red yeast rice, there's like 2 to 4 milligrams of that compound. So it's much less. But we know that it's effective because there's other compounds in there. Where did I have that? We'll probably come across that. But the point is that it's helping with inflammation, and there are many other antioxidant compounds in the red yeast rice that are also helpful and that are beneficial.
What causes the inflammation?
So that's a good point. So whether there's the trans fats did, the high sugars are causing that. How about the emotional stress? How about all of the different, all the autoimmune conditions that we have? We have somebody who comes in, this is good to know too, who does the carotid artery studies, and she can go in and there are screenings and they look at the intimal thickness in your carotid arteries, and that's also predictive of cardiovascular disease, right? And if you have a lot of inflammation from whatever condition, that can affect the carotid arteries, and that can increase that thickness. Now, it's important to get your inflammation down, and there are ways that we can do that. When we talk about coronary artery disease specifically, we're talking about the calcification, the plaque formation, the thickening in the coronary arteries, and the blockages, right? So I'd like to talk about that. Maybe we'll skip this and go straight to this. Let's go straight to calcium. So, did anybody here raise your hand if you heard the reports about taking calcium and the risk with calcium and heart attacks, particularly in women, menopausal women. So there's some studies coming out now that are showing that there's an increased risk of heart attacks if you're taking calcium supplements. So that got everybody worried. So what's going on there? In 2007, there was a study that found higher calcium intake and calcium supplementation. First of all, taking calcium supplements. There was a study that showed by taking calcium supplements that it was not associated with a lower incidence of hip fractures. So, you know, we all think take calcium and it's going to help with prevent fractures. There are some studies that show that it is important, but at the same time, there are studies that show that it's not important. So we're, you know, kind of on the fence about just taking calcium and its effect, right? In 2010, in the British Medical Journal, there was a study or a report that showed taking calcium supplements increased the risk of cardiovascular events. That was the British Medical Journal in 2010. It was a meta-analysis study. They looked at all these different studies, which added up to like 12,000 participants from 11 controlled trials, randomized controlled trials. Calcium supplements were associated with about a 30% increase in the incidence of heart attacks, and also in the smaller increase in the risk of stroke and mortality. This is to quote them. Randomized studies suggest that calcium supplements without co-administered vitamin D are associated with the increased incidence of myocardial infarction. The vascular effects of calcium supplements, especially without vitamin D, should be studied further. Although the magnitude of the increase in risk is modest, the widespread use of calcium supplements means that even a small increase in incidence of cardiovascular disease could translate into a large burden of disease in the population. So they're saying we have to rethink giving all this calcium. Well, why is that? Raise your hand if you've heard about the benefits, all the benefits of vitamin D and everything in the news about vitamin D. We're all pretty familiar with the research that's going on with that. So vitamin D acts as a molecular switch, activating over 200 target genes and regulating gene expression. It is through this, it's like a hormone, and vitamin D has a strong influence on many diseases that have a role in preventing cancer, influenza, asthma, inflammatory bowel disease, multiple sclerosis, diabetes, hypertension, and heart disease. So not just helping with osteomalacia, rickets, and also with osteoporosis. How does vitamin D, I don't know if I got this. The point is that vitamin D is really important to prevent cardiovascular disease. And so I just want to talk a little bit about that and how that happens. Vitamin D inhibits vascular smooth muscle proliferation. It suppresses vascular calcification. It downregulates pro-inflammatory cytokines. It upregulates anti-inflammatory cytokines. And it also acts as a negative endocrine regulator for the renin-angiotensin system. In other words, it affects blood pressure. There are studies that show that this was a study that was reported in, I think, 2004. Anybody know what the levels are recommended for vitamin D? If you get your test done? First of all, up until like a year ago, or maybe 2 years ago, but you couldn't, if you went to your medical doctor and you wanted your vitamin D levels tested, you couldn't get it done. But now we know all the research is there, and now they all do it for you, right? So it's important to know your vitamin D levels, because if they're too high, it can be toxic, okay? So that's one of the reasons we test for it. We also know that if we're in the northern latitudes, we don't get enough sunlight. We just don't get enough vitamin D. We don't get enough vitamin D here. In the winter, we're not outside. Even if we were outside, we wouldn't get enough vitamin D. And in the summers, even if the sunlight was strong enough, we're all putting on sunscreen lotion to protect ourselves from melanoma. So vitamin D is a big issue up here. It's involved in many, many health conditions, including autoimmune conditions. Who doesn't know somebody who has an autoimmune condition? That is a problem with that causes inflammation, right? So nobody knows what the levels are. If you go and get your levels tested, they want them over 30. Most people who get their levels tested, you're going to see it in this area. You're going to see them down 20, 10, 12, 18. Sometimes you'll get people who are taking high levels of vitamin D and it goes up. But for the most part, most people are deficient. The average here, if we went in, you'd probably get, it would likely be under 30. And a lot of people would be under 20. So this is a study that looked at vitamin D levels of individuals who had less than 20, and they had a higher prevalence of angina, heart attacks, and heart failure compared to people who had more normal levels of vitamin D. They again looked in, they looked between 1988 and 1994. Then they looked at it between 2000 and 2004, and they found less than 20, you had an increased rate of coronary heart disease, heart failure, and peripheral vascular disease.
What's too high?
Too high is really, there's different information about that. Like, people have different beliefs, but if we start getting around 90, 100, 110, I've seen 130. But generally, what we want to think of as optimal levels. So 30 is what they'll say is normal. But generally, we like to see things around, most naturopathic doctors, alternative practitioners, holistic integrated practitioners want to see them around 50, 60, 65, 70. There are other people who want to see them much higher, 80, 90. So that's, there's some range in there where, because all the research is coming out, the levels that people see, research is reporting as being optimal is sort of different than what is being considered still standard. So, the standard recommendation is that they need to be over 30, but most people who are in the know of vitamin D want them up around 50, 60. Yes?
I keep reading about being very careful what kind of D you're taking, and it must be vitamin D3 and not D2.
Conventional medicine, wisdom says that D2 and D3 are equal. D3 is not natural in our bodies. D2 comes from a, I believe I'm not sure if it comes from algae, but it's a vegetarian source. And for all intents and purposes, people consider them to be the same. However, there are reports coming out now who feel that they're not the same. And there are some studies that are starting to show that they're not the same. So conventional wisdom says that you can interchange them. However, again, it's not natural to the body. The reason that we even talk about D2 is, vegetarians will often get their D2 that way, and the conventional medicine will give you like 50,000 IUs of vitamin D at a time, like once or twice a week, to get your vitamin D levels up. So your vitamin D2 levels will come up, but it's not your D3 levels. That's still debatable, but I do recommend that people go with D3 because it's more natural. I do see clinically that people who supplement on a regular basis D3, daily, and working with somebody to get your levels up, whether it be 5,000 or 10,000 IUs. I think the RDI right now is like 800 or 1,000, so they didn't really increase it that much. But the point is, everybody's different because it's based on your skin type, your sun exposure, where you live, your skin color, whether you're going into tanning beds, your diet, your liver. There's so many different variables. So I think it's really, really important that people do test their vitamin D levels. So you can ask your doctor, and they can test your levels and see where they're at. And then if they're low, then I would recommend that you do take a D3 or talk to your doctor and figure out how much D3 that you need and then recheck your levels to make sure they don't go too high. There can be problems if they're too high. But it's really hard to do. In 30 minutes of sun exposure, like if you were just to go out in midsummer, your shirt off for 30 minutes and get sun exposure, you can make 20,000 IUs of vitamin D at one time. Still the winter, I know the flu bug's starting to go around, the cold's going around. One of the best ways that you can prevent a cold is taking vitamin D. There are studies that show that epidemiologically, the reason why we get the flu in the winter is because that's the time when all of our vitamin D levels decrease, and so our immune system is decreased and makes us susceptible. So one of the best things you can do in the fall is make sure you get because you're not in the sun as much, your vitamin D levels go down, you need to increase them up, and that can help your immune system and help prevent you from getting the flu and from getting the cold. There are people who recommend doing high doses of vitamin D. There are studies that even show doing like hundreds of thousands of vitamin D just for a couple of days when you get the flu will knock it out of your system. Again, work with a healthcare provider if that's something that you're interested in doing, but there is research out there for that. What else was I going to say about vitamin D? If you don't have health insurance, if you're not working with a primary care doctor, one of the neat things about I also help out with a wellness. Well, the wellness center is the clinic, but on the floor where the supplements are, I'm always helping out people there. Not everybody has access to lab work, so we are providing a special because I think it's so important for people that they can come in and get their vitamin D levels checked. It's a finger prick, and you send it in, and we get the results in a week's time. And it's also a good way to test your children for that too.
Can you do that, like if you come in for that cholesterol check?
It's different than the cholesterol check. It's a yeah, I mean,
we do both at the same time. pull the blood?
I think we could do it. A take-home test is what we do. It's just you do it at home. It's a little lancet, and you do it, and then you send it in, and then you come back for a 15-minute consult to go over your results. That's how we're doing that. The charge on that is $100 to do that. But if you have insurance and you have a doctor, you ask them to test it for you. But if you don't have access to a test and you want to do that, that's something that we've been wanting, that I feel good about providing here to the Pilgrims community. There's so much good things I want to talk about, and I know even if I don't have a screen up there, I still get bogged down in the details. So there's something I really, really want to tell you that's important, and then we can have a snack. I'll just go over. Vitamin D deficiency had a 50% increase in fatal stroke. So if you were deficient in vitamin D, it's been shown to cause stroke. If you were deficient in if your levels were 15, you had a 3 to 6 increase in developing high blood pressure. It's been implicated in arterial stiffness. So the physiological level seen in nature is 40 to 65 in the summer and drops to the low 30s in the winter. Of course, that depends on where you're at, and there are other people that show that we need to have levels higher, and there might be therapeutic levels for having that higher. I think I just need to summarize this. I'm just going to use this. So raise your hand if you've heard of vitamin K2. Okay, good. So vitamin K2 is different than vitamin K1. Vitamin K1 we get from eating, what do we get vitamin K1 from? Yeah, green vegetables, right? Spinach, kale, those types of things, sure. What we're finding is, right, I told you about this, with people are taking high doses of calcium, we're seeing an increase in heart attacks because we're getting coronary artery calcification. We're also seeing calcification in joint tissue and the peripheral tissue. This is because we're not getting calcium into our bones. Even the studies showed even with taking vitamin D, we're still having problems with coronary calcification. And this is because we need to have the other fat-soluble vitamins, vitamin D, vitamin K, they're fat-soluble vitamins, but we need to have those to balance out the vitamin D and the vitamin K. What happens is if we're having high doses of, if we're ingesting a lot of calcium, and even if we take vitamin D also increases our absorption of calcium, so we're getting calcium really high in our system, but we're having difficulties getting it into our bones. Vitamin K2 is essential for getting the calcium into your bones and out of your peripheral tissue. There are some similar mechanisms to K1, but the only way that we get K2 in our diet is by eating grass-fed meats and dairy. Or if you eat natto, a lot of fermented products can be high in it. The way this works is you need bacteria to turn K1 into K2. We do not do it ourselves. We do it minimally in the bacteria in our intestines, but we cannot really do it in substantial amounts ourselves. So what I told you about Weston Price, what he did is he went around and he was a dentist, and he looked at people's teeth, and he said, this is not right. All this crowding, we're not designed to have our teeth and our jaws this way. What's going on here? So he was fortunate enough that he was able to go to all these indigenous cultures while they still existed. And he studied their jaws, he took x-rays, he looked at all these different reasons why these cultures had really good bone structures, facial structures, teeth structures, or their teeth were healthy, and he said it was because of the foods that they ate. Primarily, one of the things that was really important was that they all had dairy and grass-fed meats in their diet. So at the time, he didn't call this substance. He identified a substance that he called Activator X. And it wasn't until recently, I forget the year, but I don't know, probably like 10, 15 years ago, that they connected it and said that, hey, what somebody recognized as vitamin K2, this is the same thing. And the reason for it is when in the springtime and the summer, when the grasses are growing really fast, they're very high in vitamin K2. They're very high in the other fat-soluble vitamins like beta-carotene, right? So the meats of these people, the animals that were eating the grasses end up having high content of vitamin K2, and bodies would convert it into vitamin, they had high contents of vitamin K1, they would convert it into K2. They found that it would go into the milk supply, it would be in the eggs, it would be in the meat, and people who ate this were very healthy. If we look at indigenous cultures, we see that there's some of the things that are mainly different than what we do today, and that is that they would eat the bones and the bone marrow, or make broths with the bone marrow. They would eat the organs, and they would eat meat of grass-fed animals. They would eat a lot high fat. They would eat and they would eat the dairy, the cheese. So the cheese, milk is supposed to have a real rich color to it. When you see butter, it's supposed to be yellow. A lot of the butter is not yellow unless they put coloring into it, right? So look at this cheese. Do you see how yellow that cheese is? That is cheese from grass-fed cows. We sell that here. It is really tasty. It's really high in beta-carotene. That's what gives it its yellow color. If it's high in beta-carotene, it's high in K2. Butter is high in K2. This is sausage from cows that are raised on grass. Eggs. So the take-home message is dairy, milk, cheese, eggs, and meat, as long as the animals are eating grass, is actually really beneficial for you. And I have studies here that show how the proportion of vitamin K2 that you have in your diet, how that prevents coronary artery disease, how that prevents kidney stone formation, and it's all by activating these proteins that take the calcium and like it can activate osteocalcin, which puts the calcium back into your bones. That's not added. That's just from the milk.
Well, I mean,
yeah.
You said that's kind of what creates the color,
Yeah.
is that the beta-carotene is good.
And that's an indicator then.
So do carrots then help?
No, because that's not K2. That's beta-carotene.
It's just beta-carotene. Okay.
Yeah, but that beta-carotene is an indicator. Now, I think if, well, I'm not sure about this. I mean, I know the grasses. I think other vegetation could do that as well. But generally, we think of grasses. I mean, we're not seeing cows and other animals eat, getting their main food from carrots, and I don't know about that, but I know it's from the vegetation when it's active and growing fast. So vitamin K dependent proteins throughout the body, they carboxylate something called the glutamate residues, and they change them into gamma carboxyglutamate residues called GLA proteins. So if you ever hear GLA proteins, GLA, that's what that is. And it binds the calcium. Vitamin K2 is needed to activate proteins which bind calcium and keep it from precipitating in the peripheral tissue and or organs. The matrix GLA proteins, also abbreviated MGP, is found mostly within the arterial walls, veins, and cartilage, and is associated with chondrocytes, but also associated with cells of other soft tissue like brain, kidney, lung, skin, testes, sperm, salivary glands. The one identified role of these proteins, which vitamin K2 is needed to activate, is to reject calcium deposition in these tissues. What's really important is that we all get the fat-soluble vitamins, because vitamin A is really important to negate some of the side effects of vitamin D and vice versa, and vitamin K2 is really important. So it is really important that we have all these fat-soluble vitamins. If we have vitamin D, I think I already mentioned this, but if we take too much vitamin D without having vitamin K2, we get an increase in calcium in our system. So that's why it's really, really important if you're taking vitamin D that you also take vitamin A and that you also take vitamin K2 with it. Yes?
I'm getting confused because prior to this, I've heard about using magnesium for the same reason as K2.
There are other things that are really important for osteoporosis prevention. Boron's really important, strontium, magnesium. These are all things that will facilitate that. They won't have the same function as vitamin K2. Vitamin K2, so much of the problem why we're having cardiovascular disease is the way that we're living, right? We're sedentary, we're eating high sugar, our farming practices, right? We're not, the majority of, okay, this is a good one. Who knows what SAD stands for? And if you've been to my lecture before, don't. Seasonal affective disorder, or the SAD diet. What's the SAD diet? What is the SAD diet? I mean, we all know it. The standard American diet. Okay, so probably not you guys, but the majority of people are eating crap. And if they're eating vegetables, what are they eating? Corn, right? Potatoes, ketchup. And if they're also eating a lot of conventional farming techniques, they're certainly low in micronutrients, so we're not getting magnesium, potassium, all these. There are less nutrition in them. So we're out of balance, right? And then if you throw in there, people are worried about weight, so they eat, they try to avoid fat. We're not getting the good fats that we need. We're not getting the vitamin K2. We're not getting the D. So we're out of balance. So I think so much of what we need to do is restore that balance. And the way that I like to look at a big thing for me is to look at how indigenous cultures ate and acted, and to think about these people have been doing it for thousands of years. Thousands of years we've eaten a certain way. I'm fortunate, my wife is from the mountains of Austria, like the Innsbruck area, up in the mountains. It wasn't until she was like 10 years old that they first put a road up there, right? So her culture was considered indigenous. Her mother's visiting us from Austria right now. And I had her make Leberspätzle, which is like liver spätzle soup. There's this inherent wisdom that we knew that we've lost to eat a certain way. When we talk about cuisine from different cultures, we're talking about eating a certain way that made sense, that there was a reasoning for doing that. I could not just go and eat pig's brain right now. It's not part, but if you lived in that culture, you used every part of the animal. And it wasn't just for waste. There was a reason that we did that. And you learned how to cook it, and it's part of that, like blood sausage, like that doesn't sound good to us, but if you're from that culture, you like blood sausage, right? You like liver. Most of us don't like liver anymore. So we're losing that culture. So if you're at all interested in the things that I'm discussing, I'd recommend this book called Deep Nutrition. Her name is Dr. Shanahan. I just recently discovered it. I haven't read through the whole book, but I've had patients who've done that for me. And from what I've read and the synopsis, it talks about all the things that I recommend to patients. So I'm really excited about this book, and I hope to one day be able to finish it. She has a Cliff Note version called Food Rules. And that's also a good book. I don't subscribe to everything she says in there, but it does go over a lot of things that I discussed tonight. I really wanted to be able to answer all your questions about herbs and vitamins and nutrients, and I have things that I want to talk about, but let's make sure for at least 15 minutes that I can be there and answer some questions, and maybe some of these other important things will come up. Yes?
You mentioned eggs a couple of times through the grass-fed thing, and I don't associate chickens and ducks, the eggs that I eat, with them being grass-fed animals. I mean, so how are they? So
it's not normal for them to sit in cages, or even if they're cage-free, to just be fed grains. That's not normal. So, if you've ever been to chickens, what's a classic picture of like a farm, 50, 100 years ago, right? The chickens are running around eating grass, eating insects.
So they do eat grass. Somehow I wasn't imagining that.
No, they do eat grass. So that's why if you ever, I just remember my wife's their little farm in the chicken area, there was never any grass there because they just eat it all. So it's just mud. But it's not that so the chickens eat the grass, like even cage-free, yes, it's better. And in fact, the one thing to be wary of is if they say, higher amounts of omega-3, that's really good, right? But they're giving them flax seeds to do that. So the best thing is to go, there was a huge Amish community in New York where I was, and I did house calls to them, and they'd always just give me eggs. Their chickens, are out of bound. So if there's farmers here that I know we sell them here. If there's, farmers markets, you can find eggs where ask them, do the chickens eat grass? And now, of course, like in the winter when we got snow, they're not eating grass. Okay, but we know that's, there are cycles to things, but we want them to, have access to grass. You had a question.
Well, you mentioned earlier, we were talking about the cholesterol levels. You said to remember 330 total cholesterol. What was that about?
Yeah, they said that, you're not going to have problems unless it's above 330. So we're like shooting for like 200. So I guess the point is, we're still figuring things out. I don't have all the answers. These people that, who are scientists, theories change all the time. So for me, the most important thing is to okay, what's out of balance here? What makes sense? What can we do? Now, a lot of people are beyond that, right? You've already got cardiovascular disease. So what do we do? And there are things that can really help with that. So what I'm talking about is prevention. I'm talking about us as a society, the way I see things need to be restored to balance. But I'm also telling you, yeah, I think it is a good idea to see where your cholesterol levels are, but that's part of the picture. Is it worthwhile to take a statin medication to deplete CoQ10, which your heart needs, which could cause a heart attack? The information where we saw where there was 100 people on a statin medication, and you needed one person, you needed 100 to get one person to prevent a heart attack or a cardiovascular event. So I'm just saying we need to rethink this. My point in talking about these things is I think these are concepts and theories and things that you may not be familiar with, and I think it would be a disservice to not become aware of that. I think you should go out and do research by yourself. You can have discussions with your healthcare providers. They may or may not be familiar with that, but do the research yourself. I want everybody to know that all these articles that I can find, these abstracts and journals, you can go to www.pubmed.com, P-U-B-M-E-D. It's a government service. All the research abstracts are there for you to look at the abstracts. So it's like a synopsis of it, a summary, so you can do the research yourself.
And the government's allowing this?
No, that's what our taxes pay for.
Yeah, but usually they go the other way.
No, this is a great thing. It's a great service to have. So you can do the research by yourself. You don't have to just Google something and get somebody else's opinion. Go look at the research. Now, the same thing, just as we can be leery of research that is being supported and provided by drug industries, the same thing happens with nutraceutical industries, and especially since a lot of the nutraceutical industries, right, a lot of them are supported by or bought or owned by the drug companies now too. So there's a lot of, there's misinformation, there's a lot of theories. I just want it to be clear that there are different ways to think about things. And for me, the most important thing is to look at what's out of balance, what can we do. Theories change, theories come and go. We get more research, we get more knowledge. But the more we know, the better. And I want you to start thinking about these things. Okay. Do you want to talk about some herbs and some things that are helpful?
Sure.
Okay.
www.
.pubmed.com.
Now, are articles there that are featured by drug companies as well?
Yeah, there are. And they're supposed to say, like, if you the other thing is on that, getting the abstract, a lot of if they're government funded now, they're required to post a full article on there. So you can download in PDF format the full article, the full research. Now, mind you, I went to medical school, so I can read these things. You're welcome. Do you want to taste some grass-fed butter or cheese or salami? Please help yourself if you'd like that.
Thank you.
Okay.
We have our little dog in the car. We have to go. We would stay.
Okay. If anybody needs to go before, I guess just at the end, when we're done talking, we'll just have you try some of these samples here. But we have sampled grass-fed butter. These are things we carry in the store, but these are things you can get at local, farmers markets and things like that. Whole grains are I think whole grains are really important. Sprouted grains. That's sort of a traditional way of doing things. Yogurts are really important. Grass-fed yogurts. I like the organic or the Stonyfield Farms organic yogurts here. They're whole milk and they're high and they're grass-fed. But there are other ones. The butter is just absolutely amazing. So I just thought it was, and the cheese, and then this is salami. And if you do shop in our store, we have we put my face, a picture of me up next to certain products so that you can find them. That we'll just say one of Dr. Toby's favorites. There are certainly other companies and other ways to get them, but I think they're delicious. And I thought I had to do this because we think in our mind how bad these foods are for us, and they're not. So, you know, the sausage, I'm not sure exactly what goes into this summer sausage because, but I know that it's from grass-fed meat. And the fats from that are good. I'm sure even if there's tissues and organs, that's really good. So, you know, I'm like, what? That's good. You know, even if there are things that we normally don't want to have in there, it's actually healthy stuff. It's not rancid. There's no nitrates in it. So I kind of think it's probably a good thing. Yes?
So is pork typically, or I should say not typically, but can pork be one of those grass-fed?
Yes, you can feed them grass. They eat a lot of different stuff. To be honest, though, I mean, I don't think it should be. It's probably not as good as other things like venison and you know, beef and lamb and buffalo that are eating grass, because they're. I don't know. I mean, they do eat grass, but they're also. I don't know how they're raised. I think if they were eating lots of like natural foods, I just don't. I know there can be pasture-raised pork because when I was in New York, they sold pasture-raised pork. So I don't really know what that means because I know like a lot of times they give them slop too, and so who knows what else they're given. But I think theoretically it should be good. Excuse me. Yes.
Yeah, where's your butter come from? Is it Amish butter?
No, this is butter from Organic Valley, and it actually says on the package pasture-fed butter, or pasture-raised, and it's high in CLA. The other thing good about this is, like, I do recommend people take vitamin K2. You can take K2 as a supplement because you want to get at least 49 micrograms of K2. And I have something here that I wanted to read, which shows like how much, like if you eat one egg, how much K2 you're getting if it's grass-fed. It's like 5 micrograms if you eat one egg. Please don't quote me because that's not right. But I have it written down somewhere and I don't remember where it is. But butter is particularly high in it, but we want to get at least like 45 micrograms. And there's a couple ways to get K2 as a supplement. You can get it from, there's different versions, but primarily the ones you're going to find is something called MK4, which is a type of K2, which they actually make from tobacco. And it's a little bit more processed. And then MK7 is a form from natto, so fermented soy. It's like a breakfast cereal. It's supposed to taste horrible, but Japanese love it. But the idea is that actually all fermented foods are really good for us. So if it's fermented, it is going to have some K2 in it. So that's why, and you're going to get good bacteria, and you're going to get good yeast, and it's going to help your whole bacterial system. I'm sorry, what's that? Yes. Yeah, and it's also, if it's grass-fed milk, that's going to be really good too. Now, I've read before that we don't get enough, please try the butter, it's so good. And grab the cheese and the...
Sorry.
And if you're at all, the other thing is if you would like any of my research, you can sign up here and I'll pass that on to you. Where was I? Oh, I'm not, supposedly we cannot make K2 ourselves, that we're really inefficient in doing that. And I wonder if that's because so many of us don't have the right bacteria in our system. And I wonder if we did eat a lot of fermented products and if we had the right bacteria in our systems, if we might, you know, the studies, what are the studies looking at? Probably average Americans, right? Or average people who are not eating that. So I wonder if we did have the right bacteria in our systems, if we can make the K2 ourselves from K1. We are supposedly inefficient at it, but I do think because we're so out of balance that it does make sense, especially if you're taking vitamin D, that you do take a K2 supplement, and at the very least eat products that are high in K2. The other thing is we talked about balance, we talked about how science and theories change. We don't know what other nutrients may be in there that we're not naming right now that's part of a traditional whole foods diet. So if we do eat these foods, we're getting other nutrients and things that could be important for us that we don't even know about yet.
What about chia seeds?
As far as, are they good? What are they good for?
I was going to
say they're so good in everything.
They're high in protein, they're high in omega-3. The type of omega-3, though, that they're high in is like flax oil. And it's still debatable, but there are some research that shows 70% of people can't turn the flax oil and that type of oil into the EPA and DHA, which is what our bodies need.
How many percent?
I think I've read 70%. It's something I need to look in more, but I think in general, if we want to supplement omega-3 fatty acids, we want to have EPA and DHA, and I recommend taking a high-quality fish oil, which has also been shown to help with heart attacks, help prevent. Yeah, I have a study here. Some of the studies on the effects of fish oil. Okay, this is a good study. Fish oil does omega-3 fatty acids. These are the things that they've been shown to do. Dietary and non-dietary intake of omega-3 fatty acids reduces overall mortality, mortality due to heart attacks, mortality due or sudden death with coronary heart disease. Fish oil consumption directly, indirectly affects cardiac electrophysiology, so it reduces heart rate, a major risk factor for sudden death. There are studies that show it helps with tachycardia and other arrhythmias. However, they state here, among patients with implantable cardioverter defibrillators, omega-3 fatty acids do not reduce the risk of ventricular tachycardia or fibrillation and may actually be pro-arrhythmic. The consumption of omega-3 fatty acids leads to 10 to 30% net decrease in triglycerides. So it's also really helpful for triglycerides.
There's a product that I have been buying here called Ovega, which is, since we overfish, that's kind of why I looked in that.
From algae?
But it's the algae, and they're saying that the balance of the right omega-3s is better even at that level, because it's what the fish eat, that when we eat the fish, we get that.
Well, I know, and you hear about that. Well, here's the thing. You hear about like krill oil. Mm-hmm. The thing is, if you want to use, it's like, for me, it's like comparing apples to oranges. There's other things that you have to compare that way. Like if you were to eat take a multiple vitamin that had standard amounts of vitamins in it versus the Whole Foods multiple vitamin, they're different because they don't have the same levels, but they're supposed to be more bioavailable. Well, we know that the fish oil in krill is more bioavailable. They're bound to phospholipids. We get more in. So the studies say like you need like 500 milligrams of the EPA and DHA if you add that together. So, make sure you get enough of the krill oil. But you can also, I know, there's so much research on taking omega-3 fatty acids that but you have to get the right amount. You have to get the right amounts of EPA and DHA. So for people who don't have any specific, illnesses that they're trying to use it as a therapeutic treatment, maybe you want to get 1,000 milligrams of EPA and DHA. But if you just take one fish oil capsule, you're getting, most of them are like, less than 200. So that's something to be wary of. And the other thing is, we talked about the problems of oxidation, fats that have oxidized. If you get a standard fish oil capsule from, a large supplier, that it doesn't matter where you get from. If you get a fish oil and you bite into it, or you take it and you burp it up and it tastes real fishy, when fish tastes fishy, it's rancid. Like if you've had sushi, does sushi taste like fish? Do you taste fish? Absolutely not. You don't. I grew up and I ate the standard American diet, and I grew up and had so much soda. Just crap, okay? And I didn't eat any fish. I couldn't even eat a fish stick. Now I absolutely love sushi. And it doesn't taste like fish. I don't like the taste of fish, okay? But bite into your capsules that you have, or take your liquid. It should not taste fishy. If it tastes fishy, it's gone rancid to varying degrees, and it's oxidized fat that's going to hurt your blood vessels. Yes?
We've both been urged to take blood pressure medications. They've had all kinds of side effects. Do you have any recommendations for natural alternatives? Reduce sodium, all that. We've done all those things.
Yeah, there are things that can be real helpful. Vitamin D has been shown to reduce that. There are supplements that you can get that can reduce that, like bonito peptide I think is really good. Hawthorn can be helpful, but it's kind of minimal. I did print out something that I wanted to go over regarding hypertension. CoQ10 has been shown to be helpful, and there's a lot of studies on fish oil being helpful. Potassium, eating a lot of fresh fruit and vegetables. You know, reviewing your diet, looking at your diet, making sure your simple carbohydrates are down. Fiber can be really helpful. Garlic, a lot of good studies on garlic. What else do I want to say?
Celery. Is there any
celery, I know there's been, yeah, I think there is, yeah. And you'll love this one, chocolate. Dark chocolate. And you know, the other things is we're dealing with inflammation. So you want to there's different reasons for hypertension, but you know, we do want to deal with that inflammatory role. So like pomegranate juice, berries that are really high in antioxidants, blueberries. You know, these were all parts of our diet. So and also, you know, minerals, trace minerals are really important for a lot of different things. So that's the other sample I have here. That's what the mineral water. This is a spritzer. And it's San Pellegrino, but there's other mineral waters, but they're very high in minerals. People have a hard time absorbing minerals. If you've had resection of your colon, they've been shown to really absorb the magnesium and calcium through mineral water. And so I like to get people off of like sodas and drink mineral, like spritzers with mineral water and like pomegranate juice. This is a pomegranate blueberry combination. You can do equal parts. With time you can do less. So I'd like for you to sample that as well. Excuse me. Yes?
Yeah, I worked overseas, and we had, the military was giving us all mineral water, but they thought we needed our minerals. And everybody started coming down with stones. Way too much mineral.
But you know what? It could be the same thing as like with I don't know if you were getting the vitamin K2 and the vitamin D, and so there were probably other things that were out of balance.
40-degree weather just about every day, so.
You're what?
We're out in the sun all the time.
So you had the vitamin D. So maybe that was a problem. Do you see, maybe you had high doses of vitamin D, and you were increasing your calcium, and you didn't have anything to balance that with the vitamin K2. I don't know. Where were you located?
Iraq.
Oh, okay. I don't know. I mean, were you?
Every kind of food you could think of, they were shipping into there.
Were you eating? Yeah, but were they were shipping it in, right? It wasn't like, I'm sure it wasn't grass-fed butter, right? I'm sure it wasn't grass-fed milk. What?
I'm sure it wasn't.
Yeah.
No, we got our fruit from Africa and Australia and places like that.
And you know, also though, to be honest, if you were in the military, you don't know what else, you know, whether medications, other things that were being.
Yeah, they got rid of the mineral water and started giving us just regular water.
But that seemed to help.
Yeah, it seems to be.
But that does feed into what I was saying about if you increase, because I've seen this before. There are studies that to help with to help with kidney stones, you need to take vitamin K2 can really help with that and help with calcium deposition in other parts of your body. So I mean. Yeah, so if you're increasing your minerals, we need to balance that. So again, the take-home message is we've got to look at what's out of balance with us. We got to look out emotionally what's out of balance. How can and these aren't easy answers. It's hard to find all the stress that we have in this culture. We got to find ways to deal with that. So I do teach. I do teach. Yes, I'm sure you were stressed, and that doesn't help either. And you were dehydrated. The other thing is you were still dehydrated. Even if you're drinking the mineral water, I don't know how much you're getting, but you're dehydrated. So,
all we could carry.
anyways, we're going to have to shut it down here because they're going to close soon. So why don't you start tasting everything, and then I'll still be here to answer questions.